One thing that comes through loud and clear with a lot of them, particularly on healthcare, is that it's working fine. Just relax, hang in there. Down the road, it's all going to work out.
Down the road,
and that's the issue, right?
Well, look, I can't get past what's going on, how they're going to sell this thing. What are they going to say? That we're going to reduce co-pays for preventative care. That's 10 to 15 bucks. Meanwhile, premiums already going up 30–40%. I mean, people are going to be paying a ton of money out of pocket.
What did you think of Sebelius, the Health Human Services Secretary?
Don't get me started.
She's putting those guys kind of on a list. She pulled the Tony Soprano this week by saying, we're going to remember you.
Well, they did that in Massachusetts, and it didn't work. When they reformed health care in Massachusetts, they tried to get the insurers on board, and guess what? Nobody wants to underwrite business up there. What you're going to do is you're going to alienate the insurers. They're not going to want to play. They're already saying our costs are going through the roof because of all these promises we have to make to consumers.
All right, and by the way, our friends at Cash In are really going to be ripping into this one, that whole aspect of this little palace revolt going on among the insurers and the administration, all that. But John Lee Field, I'm curious as to whether the administration, its heart of hearts, knows that the numbers increasingly aren't looking up. Now, I don't blame the administration per se. Others have had lofty plans. The Bush administration, with this Medicare prescription drug thing that turned to be a ballooning disaster. It happens. But why can't they just come out and say, all right, we were wrong on this? Now they're just going full throttle with it.
Because it's all they have right now. The midterms are just around the corner, and you don't want to come out and say, look, we spent $2 trillion. The unemployment rate keeps ticking up. 4 million more people have gone into poverty since we spent $2 trillion. 4 million more are uninsured. So instead of telling these people what they want, we're going to create you jobs. What we're saying is, this administration is saying, we're going to give you health care and we're going to keep you in your homes. That's not what American people want, but that's all that they have right now because the economy is not heading the right direction they want, and they're out of time.
Well, Adam, thinking of you being here, I always check the price of things because I always want to be up to speed for you. Do you know that the price of cyanide, Adam, has actually gone down? So if you're looking at cyanide capsules, I'm just saying, in this environment, it's the one thing that has become more affordable. I defer to you.
Well, thank you, Neil. And I'm sorry to try to crash into this fantasy bubble that my friends are sitting in right now. So, Charles, first of all, the pitchman-in-chief will be President Obama. You knew that already. Jerry, premiums have not gone up 30 to 40% for the 50 million plus Americans who don't have health insurance. And, John, as you know, none of these reforms have kicked in yet. So it's no surprise that the things that you articulated, the things that have gotten worse,
Jerry mentioned about the premiums, that they intend to raise their premiums. They've already filed for that premium increase hike.
This is on people who have insurance. I mean, that's understood,
But we were told
Neil.
that our world wouldn't change. It would, in fact, get better.
No one was told their rates would go up dramatically like this.
I don't think it's a shocker that the administration is going to campaign to try to convince people that the legislation that they worked so hard to pass and hasn't been enacted yet should be enacted. I'm sorry, Neil.
Listen,
I didn't hear you.
Adam, you're right about that. They made a huge mistake. They should have focused on this thing called jobs and the economy first and foremost. They didn't. They went with the agenda, and now they have to back it up. But you know what? The point is made. Listen, you've got the Gambinos, who you have, the Lucchese.
Why are you looking at me? Why are you looking at me?
You're going to like this health care plan whether you like it or not.
Jerry, is this going to get worse before?
You betcha. You betcha. We were promised a whole lot of things. We were promised our health care costs wouldn't go up, that we could stay with the same doctor. We're going to find that all of this stuff changes.
All right, but were you offended, as I was, by Charlie's little anti-Italian route there?
Not really. I kind of agree
really? Okay,
with it. Yeah.
Whatever. All right, Jerry, thank you very, very much.